Good afternoon, everyone. Thank you for joining us this afternoon. I have with me Dr. Meg Sullivan, who will give us an update on vaccinations here shortly. But I've got a few things to speak about before we get to that. I want to recognize the fact that our metrics continue to be stable, if not trending downward. We're continuing to watch that regularly and are encouraged by what we're seeing in our community. So we want to make sure that we recognize the fact that things are improving at this point in time. In terms of vaccines, our county is 42% partially vaccinated, 35.7% fully vaccinated. I will recognize at this point the data that has been displayed by several media outlets that looks at census tract data. I want to point out, number one, that data is a bit out of date. The data that they are using came from late April, so we know that things have changed some since then. I also want to point out that what we've been asking for from the state is ongoing data so that we can continue to analyze these situations. We are looking at this and mapping it, but I've got to tell you, when the data is that far out of date and things are moving as quickly as they are, it's difficult for that to really give us a good picture of what's happening in our community. I will say that what we see on those maps is not surprising, and it's what we've been talking about since the beginning. COVID has disproportionately affected certain populations, whether that's in number of cases or deaths, severe illness. In addition to that, we're seeing the same thing with our vaccines, is that those populations are underrepresented in the vaccines that are being given out in our community, and we've been trying to pay attention to that for quite some time. So as we look at it, we recognize that our younger populations are less vaccinated than our older populations, and that our historically marginalized populations are less vaccinated. And in the locations where they live in our communities, that's what we're seeing. What I will say is that we do also know that we have been providing, both ourselves as well as both of our healthcare systems, lots of clinics in those areas, and we're mapping that as well. We'll make that information available as we can. But the main purpose for the data for us is to help us analyze our situation in our county and make sure that we are developing our plans in a way that address what we're seeing in that data. So we will continue to stay on top of that as we can, but at this point in time, what we are getting is downloads of data from the state, not having access to our ongoing data here in Mecklenburg County. So we will make the best of what we have, but just understand that what that means is quite often the data is outdated and not up to date. The really good news is that we are now able to provide vaccines to 12 to 15-year-olds in our community. Pfizer is available to 12 to 15-year-olds. Both of our healthcare systems, as well as the health department, will be providing those vaccines. And we are seeing lots of interest in the clinics that we've had today. The people are showing up with their 12 to 15-year-olds to get them vaccinated. That is great news. So we want to continue to encourage everyone to be vaccinated, but especially that age group at this point, since they're now eligible. You've also heard that the CDC has recommended the ability of people who are fully vaccinated not to wear a mask indoors as well as outdoors. That also is great news. The data that they have, the studies that have been done, are showing that the vaccines are very effective and are also proving to be fairly effective against the variants that are out there. So that allows the CDC to make that recommendation. And we're supportive of that, and we are pleased to see that happening. I do need to point out, though, that in North Carolina, we are still under the governor's executive order. And at this point in time, that requires all North Carolinians to wear face coverings in public places while indoors. So I expect that the governor will change that executive order fairly quickly now that the CDC has made these recommendations. But at this moment in time, we are still under those orders from the governor. The point that I want to make about masks is The CDC guidance, based on research, based on data, shows that we do not, if we are fully vaccinated, need to wear masks around other people. That means you have to be fully vaccinated to be safe and not to expose other people in our community. So I hope people are listening to this, and I am strongly encouraging everyone to go out and get vaccinated this weekend. There are multiple clinics available to you. Vaccine is readily available to you, and different vaccines are available to you. So if you like the idea of not having to wear a mask indoors as well as outdoors, please take full advantage of these clinics this weekend and get yourself vaccinated. That is the answer as we move forward. CDC has been clear about that. So hopefully everyone will heed that and will take this opportunity to get vaccinated this weekend. So with that, I'll turn it over to Dr. Sullivan.
Thank you, Gibby, and good afternoon, everyone. I first just want to echo Gibby's comments about really encouraging everybody who is not yet vaccinated and who is now over the age of 12 to get vaccinated. We know vaccines are safe, vaccines are effective, vaccines save lives, and we need to get everybody vaccinated. I also do want to just echo Gibby's comments that we are incredibly excited about the FDA authorization and subsequent CDC recommendation to provide the Pfizer vaccine to adolescents aged 12 to 15-year-olds. We have noted these recommendations are based on very strong science and data about the safety and effectiveness of the vaccine in this age group. And Mecklenburg County Public Health began offering the vaccine to anyone ages 12 and older at our clinics today, and will continue to do so going forward with both appointments and walk-in slots available. We also know that multiple enrolled providers throughout the county are offering the Pfizer vaccine to persons 12 and older, as well as the Moderna vaccine and Johnson & Johnson vaccine to 18 and older. As Gibby said, vaccine is readily available, and please go get vaccinated if you haven't been. We are really hopeful that the new recommendation around 12 to 15-year-olds will increase the number of individuals who are vaccinated in the county, and as a way of further reducing the spread and impact that COVID continues to have here. In preparation for this recommendation, we have been working on several strategies to ensure that equitable access to the vaccine throughout the county extends down to this age group. And so as part of our ongoing efforts to provide outreach, information, and vaccination opportunities throughout the county with a particular focus on populations disproportionately impacted by COVID and those who have ongoing challenges accessing the vaccine, we will continue to offer and ensure vaccination opportunities at prioritized and convenient locations throughout the county. A particular note, I want to highlight an event that we have this weekend on Saturday, May 15th from 12 p.m. to 4 p.m. at the Movement School on Central Avenue in partnership with Commissioner Jarrell, with Novant Health, Cardinal Innovations, Walmart, Pride Magazine, and Freedom Fighting Missionaries. We are really hopeful we can get lots of individuals ages 12 and older vaccinated at this event. We also continue to be highly engaged in provider outreach to increase the number of enrolled providers who provide the COVID vaccine, with a specific focus on census tracts that have a low vaccine uptake and high social vulnerability index, and on pediatric providers. We'll also be relying on our school nurses to provide accurate information to students, staff, and parents about the vaccine as we work to get our adolescents vaccinated, and have been in communication with CMS about various opportunities to provide the vaccine at school sites for students, staff, parents, and the community members. And in particular, we are working with CMS, both of our hospital partners, one of our federally qualified health centers, and at least 2 community vaccine providers to be providing multiple vaccination events at CMS schools throughout the county next Saturday, May 22nd. And we look forward to sharing more details about this coordinated event next week. Of note, I also want to take the opportunity to remind everyone of our homebound vaccination program, which will now include the option to provide the Pfizer vaccine to homebound adolescents ages 12 and older, as well as their caregivers and others in the home. And we really encourage parents or guardians to submit a request or reach out to us with more information. And finally, I just wanted to briefly highlight another CDC recommendation from yesterday's meeting that now allows for the co-administration of other vaccines at the same time as receiving the COVID vaccine. And this recommendation will be critical as part of our efforts to ensure children are up to date with their other routine immunizations prior to the fall, while continuing to provide the COVID vaccine at every opportunity. And finally, I'll just close again with Gibby's comments around, we know the vaccine is safe, we know the vaccine is effective, and we really need to get everyone vaccinated. Thank you.